Hey, what's up, YouTube? It's Brandon Mattingly. I want to touch base with you guys just for a minute. I want to answer some questions about what to expect with your brand new denture. I've had a lot of people that have been asking me these questions via Facebook and so on and so forth. I encourage you guys. I'm on Facebook. I think I'm wearing a black shirt. If you go to Facebook and look for me, let me see real quick. Yeah, I'm wearing a black shirt and sunglasses under Brandon Mattingly. You guys come visit me on my page, whatever. But anyway, a lot of people were inboxing me and they're saying, hey, what can I expect, right then at the time that I get my dentures? So let me start off by saying this. If you have already made your appointment, it's coming up soon, or you're thinking about getting an appointment, but you're scared, know that you are not alone. We all go through that, myself included. The week leading up to my dental extractions, I swear to God, I thought I was going to have a heart attack. I was a nervous wreck, and I mean, I was terrified. I mean, seriously, the problem with it is that you're going into the unknown. You don't know what to expect, and typically people who have the need to get dentures don't have the best track record with dentists, be it that we fear them, be it that our teeth are just bad and it's always bad news. So you have to understand that your fear is justified. But me being on the other side, let me tell you, your fear is, I'm telling you, you're going to overshoot it. You're going to overshoot it by a mile. It is the simplest, easiest, on a pain scale of 1 being the least and 10 being the worst. At absolute peak, the worst throughout this entire process, my pain never went above a 3. Never. And I'm talking post-extraction, never went above a 3. And I'm a sissy, so that's saying something there. So you make your consultation visit. They're going to take you in. They're going to basically, they're going to look at your mouth, and they're going to say, hypothetically, your mouth size is a 6. I don't know why they do this, but they will shove a tray full of crap into your mouth. It's about 6 sizes too big. You just expect it. I had horrible teeth. When they did this, I just knew in my mind, when she pulled that thing out of my mouth, it was going to rip out half the teeth with it. It didn't. Somehow it did not. So that is the first thing. They're creating a mold of what your current bite situation is, okay? Because post-extraction, the day that you get your extractions, your immediate denture, they're trying to anticipate the amount of swelling that should occur. They're also trying to anticipate what your mouth is like in a normal setting. So that is the reason that they take that mold. So they do the mold, and you'll come back probably a week later. For me, it was like a week later. I came back in, and that's the longest week ever because you're terrified and you just know it's going to be the end of the world. Again, it's justified, but you're overdoing it. So you'll go in for your extraction. For my extraction, I had every one of my top teeth extracted at one time. The worst part to it is the shots. You get those shots in the mouth, that always sucks. It doesn't matter who you are, the shots in the mouth always suck. Once that numbness sets in, I think it was like 2 hours, maybe 3 hours, and I'm out the door with the denture in place. Now, the immediate denture to me is very important. And the reason that it's important is because it serves as a bandage for your gums. Another reason that it's important is because it will limit the amount of swelling that your gums can do because they can only swell so big. The denture will contain that swelling. And the third thing that, and I don't know if this is factual or not, but I believe it to be true, is that with that immediate denture that you're wearing right from the start, it essentially trains your gums to heal in a manner that will accommodate the wearing of a denture, if that makes sense. So the day of my extractions, I got them done and was not really in pain or anything like that. I did anticipate an extreme amount of pain once the numbness wore off. So whenever I got home and it had been the appropriate amount of time, I went ahead and took an anti-inflammatory, which the dentist told me to take to limit the amount of swelling. And then I also took the pain pill that they had prescribed to me, thinking that when this numbness wears off, it's going to suck. I took the medicine and then I went to sleep. The next day, I woke up there was a little bit of blood on my pillow. Drooling, you need to know that drooling is something that will occur for the first little bit. The first few days that you have your denture in, your mouth is going to recognize this denture as being a foreign object in the mouth. Just like if you chew on an ink pen, it causes you to salivate. So when you have your denture in your mouth, especially in the beginning, it will cause you to salivate a little bit. So day 2, after I woke up, like I said, there was a little bit of blood on the pillow. Nothing, it wasn't like a Freddy Krueger scene or nothing like that, but there was a little bit. I concentrated day 2 on grabbing books, and I would read out loud. The reason that I was doing this is that I noticed that there was a difference to my F's, the letter F, and also the letter S. Those 2 letters, I was struggling. I sounded like Sylvester the cat, like it wasn't working for me. So I would read out loud so that my body was forced to practice. I wanted to make sure that, my grammar and my I don't think it's phonetics that I'm looking for, but I wanted to make sure that I could speak and it not be a distraction by my inability to communicate. So I practiced. Food consumption, I Boost and Ensures. Those are 2 drinks that the nursing homes give the elderly people that cannot eat. It's intended is to maintain weight, and it's also intended to provide your body with nutrients. So I ate a lot of, or drank a lot of Ensure and Boost. I also opted for Roman noodles. There's a high protein content in Roman noodles, and it's soft, it's easy to make, so on and so forth. So I opted for that. I will tell you this, I made a stupid mistake. I decided that I was going to make my Roman noodles, and then I was going to cut it into bite-sized pieces. Since chewing was not an option day 2, I was going to cut it in bite-sized pieces. I was going to take a drink. I was going to put the ramen noodles in my mouth. I was going to chase it with a drink and swallow it like a pill. This was a stupid idea because when I did this, it's almost like it can only go down so far, and then maybe there's a valve or a gate or something that goes to the stomach. When you swallow it whole, it's too big to pass through that gate that goes into the stomach. So I literally, about 15 or 20 minutes after I ate, I got this just huge amount of pressure and pain. And it was all I could do just to lay flat. And I was laying there and I was miserable and I was in pain and it sucked. And I made up my mind right then and there. That term planking that these kids are doing where they go and they lay flat on an object, I'm convinced that they saw somebody who tried to swallow his food whole and he got stuck in this position for about 30 minutes. They thought it was funny and then they decided to mimic him. So I don't know if it's true or not, but don't do that. Do not swallow your food whole. It's a stupid idea, and you will regret it for about a half hour. So, all right, so day 2 through, let's say, day 5, 6. Chewing is not really an option. Chewing is very difficult. You can try mashed potatoes. You can try, cooked green beans, whatnot. Something that involves just a very, very minimal amount of chewing because you're not going to have the bite pressure. Even 3 weeks into it, you know what I mean? Like your body is going to tell you when you've had enough. I mean, it will. You're going to get you a scoop of mashed potatoes and you'll eat it and I got it. You get you a scoop of green beans and you'll eat it and you'll chew it. I got it. You'll grab you a small piece of chicken because you want to try a piece of chicken. You'll put it in your mouth and you'll sit there and you'll fumble with it and fight with it. And it's just, you've got just enough pain there where you can't really push any harder, but it's not enough pain to really, cry out in agony. Like, it's nothing like that. But, food, it'll come to you. You'll get it. By day 7, though, you're going to be sitting there and you're going to look in the mirror and you're going to think to yourself, I got a pretty smile. And you'll throw out your best smile and your teeth are going to be crooked. It's just the way it goes. And you're going to swear up and down that your dentist is a jerk, that they don't know what he or she is doing, and they got you a jacked up smile. You're going to swear to it. You're going to be mad because your gums feel fine and you're starting to be able to eat. Why aren't these damn dentures fitting? And I can't even mimic it. What is happening there is that your gums are healing. I promise you, it is completely normal what you are going through. Do not call your dentist and threaten them and cuss them out and tell them that they're a joke and they don't know what they're doing. You want your money back. Just know that on the 10th day or maybe the 12th day for you, whenever it is, you will be going back to your dentist, at which point they will do a soft liner for you. They will readjust that denture to accommodate what's going on with your mouth now. That is a process that will occur for 6 months. Every so often, you will, the day of your alignment, you'll go in, your denture will be tight, it will be snug. You will be convinced, I'm not swollen anymore. You will be convinced that that is the case. Give it a couple of weeks, and all of a sudden, your teeth are going to be falling out of your head, and you're going to have to maybe use adhesive and so on and so forth. Just give it time. I promise you, by the 6th month, your mouth will have it will have done 95% of the changes after 6 months. During that first 6 months, just know that you are constantly going to be changing. It does not matter that you feel normal. I promise you, you will be changing nonstop. On the 6-month mark, you're going to be able to get your new teeth, your permanent teeth. And this was funny too. This video is getting long. I got to wrap this up. The lady asked me for for my immediate denture a question that I thought was the stupidest question that a person could ask, but I can see why they did it. So here I am walking in, mouth looking like I chew rocks. You know what I mean? Like nasty, yellow, discolored, brown, disgusting yuck mouth. Okay? And the lady asked me, she says, so, Mr. Mattingly, would you like us to go ahead and make the dentures close to your natural tooth color? I think what you just asked me is that you want to know if I want you to charge me a lot of money to give me nasty, rotten, brown, disgusting, broken teeth. Is that what you just asked me? You know what I mean? Like, no, lady, I don't want you to do that. I'm paying you a lot of money. I want these things to glow in the dark. They're so white. You know what I mean? Like when you look at that chart, they're going to hand you a chart and they're going to ask you what teeth you want. I went all the way to the brightest white and then I stepped back one notch. The brightest white kind of looked like chiclets, like it was too white, you know what I mean? But the next notch down, that's what I want. I can't even fathom why she would have asked me that question. But your dentist is going to ask you the same question. On your immediate denture, you're not really going to get a whole lot of say-so. Your teeth essentially will look like, your teeth with your immediate denture will look like you have never missed a dental appointment. You've got perfect, beautiful teeth, but there's no whitening. They'll just look as beautiful and perfect as natural teeth can look. When it comes to your permanent denture, that's the time that you get to pick how long you want your teeth. That's the time that you get to pick what color you want your teeth. That's the time that, for me, I didn't like the way my immediate denture. I'm going to try to give you a side shot. Can you see right here the way that my upper lip is supported? When I had my immediate denture, over time as my gums shrank and the healing occurred, it was almost as though my top lip was shrinking in. So if it's supposed to be like this, it started to shrink in. I didn't like that. Like I aged a lot. My new teeth, I opted for longer teeth and I wanted them white. So my new teeth, they're longer. They're more predominant whenever I speak. And I wanted that because the immediate denture, to me, it seemed as though they were really short, like they were little nub teeth. And it just, I don't know, it was just, I was grateful for them and I thought they were the prettiest thing I'd ever seen when I got them. But after you get them, you really begin to notice other people's teeth for whatever reason. So my immediate or my permanent dentures, I opted for not the whitest, but the next step down. I wanted them longer and I wanted it to support my upper lip more. Guys, there's so many more things that I could talk to you about. I know I'm long-winded. This video is already at 15 minutes. I'm going to go ahead and cut this short. If you have any questions at all, hit me up on Facebook. Be sure to subscribe to my channel. Hit me up in the comment section on this video. If you have any specific questions that I can answer for you, please, by all means, let me know. I will do anything I can to help you through this process. My name is Brandon Mattingly. I wish you all nothing but the very best. Peace be with you.